We were talking to Professor Liam Fanning a little earlier, off the back of comments from the Minister for Health, Stephen Donnelly, yesterday, that he wouldn't rule out the possibility of reintroducing a mask mandate. Liam Fanning said he doesn't think so, wouldn't work. Kira, you agree with him?
Yeah, I do. And that's not to say that it may not become necessary, but I think it's premature to talk about it at the moment. And I understand why they're talking about it at the moment. They are concerned in the face of rising cases. But bear in mind this, half the cases in hospital are there incidentally. They have COVID, yes, but that's not why they're in hospital. They're there because they have a broken leg and COVID or something else and COVID. So that's the first thing. Now, I know that still puts a strain on the hospital service because currently they're still isolating those groups and all that kind of stuff. So that's difficult. But COVID is not what it was. COVID is simply not what it was in 2020. It is not causing the same level of serious illness or morbidity. It's not causing the same levels of death. It's not causing the same kind of transfer to ICU. And when you look at the other things in the paper today about the pandemic, the huge level, 55% of young women with depression during the pandemic, 4 out of 10 young men with depression during the pandemic. You do have to weigh up the impact of restrictions, all restrictions, including mask wearing, on people's lives, on people's mental health, on people's normal social activity, on society as a whole. And you have to say, those restrictions have to be warranted before we will reintroduce them, because they do have an impact that is negative as well as one that may help the pandemic. And I don't personally think that we are there yet myself. If that changes, if a variant arrives that's more damaging or serious, that's another thing. But also, the truth of it is this, and no one wants to hear this, is Omicron is so transmissible beyond anything we have ever seen in my lifetime by way of a viral infection going around, that masks aren't capturing it. And that is the truth of it. So currently, no, I don't think so. What about you?
Well, I suppose that ESRI report that you refer to there, looking at the fact that 55% of young women and I think about 41% of men suffered with depression during COVID. That report and that research was done in December 2020. That's when we were in the midst of a really harsh, severe lockdown. You could barely leave your home. You couldn't socialise. You couldn't go to university. You had to wear masks everywhere. We're not talking about going back to that. We're not talking about going back to lockdowns. I recently went to the GP surgery. I had forgotten that you had to wear your mask. They gave me a mask. I put it on for half an hour while I was in there with the children. I didn't feel that it impeded me in any way. I went back outside, took off the mask and got on with my daily life. And I think that's what they're talking about here. It's just in crowded settings. So back on public transport and back if you're in a retail environment. And the truth of the matter is that lots of people listening this morning, if you're lucky enough to go on holidays this morning, you'll be going to Spain, you'll be going to Portugal perhaps, and in a lot of those countries there still is a mandatory mask wearing in certain settings, in particular in public transport, and I don't think anybody would have any huge issue with that if it means that our hospitals are protected until we come out of this surge. Let's just keep it a short, sharp period of time.